DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan here. Thanks for joining me today on DocTalk. We're at Iowa State University's College of Veterinary Medicine. My guest, Dr. Jenn Schleining. We're going to have a great show talking about how to put chains on the calves when you pull them and what can go wrong and how you can fix those calves if it does. Stay tuned and enjoy the show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Welcome to the show.
Thank you.
Folks, Dr. Jenn Schleining. She is the Armbrust Professor of Veterinary Medicine here at Iowa State University's College of Veterinary Medicine, and she's also a food animal surgeon. And lastly, she went to veterinary school with me, so we have sworn that none of those stories will be shared on this episode. Right. Okay. Anyway, it's a pleasure to have you on the show. It's a wealth of information for all of you that raise cattle. You need to look Dr. Schleining up on the website, and we really appreciate everything that you do for our industry.
Thanks for having me. I'm happy to be here.
So we're going to talk about calving.
We are. It doesn't seem like it's all that far away, but time goes fast. So where we're going to start today is I want to discuss how to correctly put chains on. When you get to that situation, your cow's having just a little bit of trouble, might need a little bit of assistance. We're just going to walk through how to do that, first of all. Here we have Snowflake and Frosty. Thanks, Frosty. You're a good girl. To help us demonstrate how to do this correctly. A lot of people worry, should I use chains or should I use straps? And really, it's not really going to make that much of a difference as long as you use them properly and put them on correctly. So to start with, we'll start out with the chain. A lot of the calving problems that we see after a dystocia management with the calf could be related to how the chains were put on. So we're just making a loop. You want to put that loop up above the fetlock. And you can see here, we've got the ring of that chain where it's nice and snug up against the skin. And then we're going to do a half hitch that comes down around our pastern joint like this. And the reason that we want this chain to go down the front of this fetlock is because you can see from the side, as I put tension on that, it's causing the leg to bend where it's got your natural joints. What I'm going to do now is I'm going to switch this around. So you can see as we're putting this on backwards, we're going to put that chain down the back of the leg. And what I want you to see is as I pull on that, see how that makes the leg extend. And then what happens is it puts a lot of pressure up here at the growth plate. And in newborn calves, that growth plate is not very strong. And it'll pop that growth plate off. We'll look at some x-rays of that here a little bit later. The one nice thing about the chain that the strap doesn't give the advantage of is when you take your handles, and I'll grab one of those from you. Yep. There are times that you want your handle here nice and close to the calf, but it also gives you the option when you have to put a calf jack on that you can put this back a little further and get you a little extra room. When we have the strap, I'll have you hold that again. Yep. Thank you. One of the nice things about the strap, though, is that when you go to put this on, you can appreciate that maybe that pressure is distributed just a little bit more evenly, and you aren't going to have nearly the problems you might have with a chain. And you can see here how we slip that on, and then, but you only have that much room to work with. So putting your chains and your straps on is really important to help prevent injuries to the legs.
Perfect. Folks, thanks for watching Doc Talk. More with Dr. Schleining after these messages. Went great.
Cool.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Ellen Unruh grew up in East Central Kansas and earned her bachelor's degree in animal science from Kansas State University before attending veterinary school there. She is currently working on her master's degree in veterinary biomedical sciences, studying heat stress in feedlot cattle. Upon graduation, Ellen will focus on food animal medicine and do beef cattle research work.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
The new Better Horses Network is worldwide. Presented by Lucas Oil. Featuring worldwide radio and TV with iconic hosts like Al Dunning, Sharon Camarillo, Ernie Rodina, Lindy Birch, and Craig Cameron. With American Cowboy, Horse and Rider, Brushy Creek, Cavenders, and Ride TV. Worldwide radio and TV. The all-new Better Horses Network.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here at Iowa State University's College of Veterinary Medicine. I'm here with my friend and colleague, Dr. Jenn Schleining, who is the Armbrust Professor of Veterinary Medicine and is a food animal veterinary surgeon. And we just talked to you all about putting the chains on correctly, and now we're going to talk about when things go wrong if you don't do it correctly.
Right. So I've got a few x-rays here to show our listeners and our viewers. This is a front leg of a newborn calf, and what we're looking at here, this is the fetlock. This is his little knee sitting up here, and you can see that the bone is very clearly broken here, and this is a very common injury for them to have. This is right where that chain goes, and so when that abnormal pressure, you pull too hard, there's just not enough room to have the calf. This is the result of that. And you can see,
and if you just get the loop above the fetlock without that second half hitch.
Yeah, without that second half hitch, that really predisposes them to that, because you don't have any pressure distribution from having that half hitch there. If we look at it from the front, you can see here, right at that growth plate, it just popped that growth plate off. And so this is something that it's important to address it right away. We can talk about that here after a little while. But probably one of the more common things. The good news is calves are young. As long as the blood supply to the leg is good, these will heal really fast with just a cast. And so that's the good news about
So you can just cast an injury like this, pop it back into place, put a cast on it, and we're going to talk more about the cast here in a minute.
Yep, and they typically do pretty well with it. But let's talk about what goes wrong. Let's say you have a breech birth and the calf's coming backwards. And this is another area where we see some fairly frequent injuries to the back legs where they can't quite get up, or they, quote unquote, doc, the calf walks funny, and can't really stand up straight. And what we're looking at here, so this is the pelvis of a calf, and we have both femurs. Here's the hip joints here. This is a normal x-ray, and you can see that our femurs are sitting right into the hip joint. These lines right here, again, are growth plates, and this is a very common place that if there's too much traction when they're coming backwards, they'll pop these growth plates off. Or conversely, what they'll do, this is just another look at one of those socket joints of the hip. The other thing that can happen is that when you pull too hard, you can see here, it's not sitting down there anymore, and now the head of the femur is sitting right up here. There's a ligament that holds the femur into that hip joint, and then when that breaks, it causes it to get popped out of joint. Another common thing for backwards calves, unfortunately, is that we can get breaks along the growth plate of the femur, and this is down by the stifle joint. Here's your hip again. And the thing that makes femur fractures so complicated is that you can see most of the time there's so much muscle mass over the top of those. They've got one end pointing north and one end pointing south, and they don't meet in the middle very well, as you can see here. So it can be fairly complicated to get those back together. And then additionally, a lot of times to get those to stay back together, we have to use some fairly expensive implants or some other creative methods of keeping those bones together because they're really soft.
Wow. So making sure you have the chains applied appropriately. We're going to come back. We're going to talk a little bit about how we heal these calves and some things you can do to prevent some of these injuries from happening. You're watching Doc Talk, and we appreciate it.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello, Dr. Nels Lindberg here with Production Animal Consultation and Animal Medical Center out of Great Bend, Kansas. And today for your BQA tip, we're thinking about VFDs. VFDs, you're all kind of getting in tune with them and figuring out maybe what you got to do. If you're not, you really need to catch up and get with your veterinarian and start having those conversations. But first and foremost, you need a valid veterinary client-patient relationship. And if you don't have one of those, you really need to address that and get after it and get that done. From there, work with your veterinarian closely so that you're not scrambling to get those things done. And that's what our biggest concern is people prolonging and waiting to actually get those things done. And come January, February, when you need a VFD, you can't get one done in timely fashion like what you really want. So get with your veterinarian and get after it and get it done and keep at it.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
It takes vision, dedication, hard work. It takes knowing who you can trust. At Zinpro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At Zinpro, we generate results.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here at Iowa State University with Dr. Jenn Schleining, and we are in their clinical skills laboratory, and we've been talking about how to put chains on appropriately, things that can go wrong. And now, if we do have something go wrong, like you mentioned, luckily we can fix it.
Yeah, we've got some options, you bet. And one of the most common ways to treat fractures, obviously, calves are young, they heal quickly. We can confine them a little bit. A cast oftentimes is all it needs. It depends a little bit on what bone is broken. If it's really high on the leg, a cast might not be the best choice. But when it's the lower leg, casting is by far the easiest, it's most economical. But there's a few things that have to happen after your vet leaves the farm that need to happen to make sure that we have a good outcome. So what I have here is, this is just a cast that we've put on and taken off for the purposes of showing. Cast material is something that we put on wet, and as it dries, you can see it makes it a really hard substrate. And what this is going to do is keep that bone in alignment. The vet is probably going to put some padding in under this, but you can imagine if you've had a cast on before, imagine you probably broke a few bones in your life.
I have.
Yeah. This, not only does it keep you from moving, but it can be a little bit of, it kind of prevents your movement such that it bothers you. You can't really walk around the way you want to or use your arm the way you want to. And the same is for calves, especially if you have a young calf that hasn't stood up yet and you call your vet a couple days later, the calf hasn't figured out how to stand up. You put a cast on the leg, they can't bend it, then they might have some mental hurdles to get over and might need some help. But the one thing this tough cast material can also cause is cast sores. And so for that reason, we want to confine the cow-calf pair. Hopefully he's got a nice mama that lets you in there with him if he's needing help getting up. And so that we don't have those cast sores. If the cast is not tight, we get movement within the cast, and then we have cast sores right where the fracture line is. And so that can be a little bit problematic too. And so when we come out to the farm and put one of these on, or you bring a calf into the hospital and we send you home and say confine them, we don't mean put them in the small 10-acre pasture. We're talking about put them in a small pen by themselves where they can get up, get down. They're easy if they need a little bit of assistance. They're going to wear one of these for probably 4 weeks. Depending on how well the calf is doing, the faster they grow. We might have to take this off after 3 weeks because it's getting too tight. But that fracture isn't quite done healing yet, and we might have to put another one on.
So you might have to put two.
Yeah, yep. And every patient's is a little bit different. Every bone heals just a little bit differently at a different rate. But a cast is by far the...
But you can use these on lower limb for fractures. You can use them for that growth plate,
break,
multiple different reasons.
You bet.
Great. Well, folks, get your veterinarian on the farm. Always work with your local veterinarian on when you have an issue like this so that you can heal the calf, get things moving right. There are remedies to getting these calves fixed. And when we come back, we're going to talk a little bit more about when to call that vet. Really important stuff. Thanks to Dr. Jenn for being here on the show. Thanks to Iowa State for hosting us. More after these messages.
I've always had an interest in care for the animals and their well-being. Really what we want to do is work hard to eliminate as much feedlot lameness or beef cattle lameness as possible.
How we feed a cow on a daily basis can not only have daily effects, but they can also have long-term effects on claw health, reproductive performance, mammary health, all of those factors as we look at the inputs and the response that the animal has to what we feed them.
When animals have adequate intake of effective nutrients, we take care of the immune system and performance follows. It's important that the consumers understand our dedication to the well-being of these animals.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Horn flies are a nuisance and a production loss, so getting rid of the problem is important. What I like about the vet gun is you don't have to go out there weekly to treat them with a topical fly applicant. It has some duration, it lasts. You see the increase in weight gain, it just works. I've used it on our 1,500 cow-calf operation, and it makes me more confident in saying, hey, this product's gonna work on your operation too.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Jenn Schleining. She's the Armbrust Professor of Veterinary Medicine here at Iowa State University's College of Veterinary Medicine, where she serves as a food animal surgeon. And we had a great show today and lots of practical information that producers and ranchers could use. But the one thing we always, as veterinarians, I wish you would have called me sooner.
Right.
That thing that comes out. So talk to me a little bit about when you want people to call you as a veterinarian or call their local veterinarian to get some assistance.
Yeah, I think it's in our nature really to see, you know what, just a little dumpy today, let's give it a little bit of Banamine, see how it turns out tomorrow. These situations where these newborn calves, where the calf doesn't stand up right away, you need to call your vet sooner than later. And really, I don't think anyone has ever chastised an owner for calling too soon. And in these cases, it might make the difference between having something that you can work with and something that you can't, especially in the case of these hip joints that are out of place. Those can be fairly easily reduced, or that hip joint put back in place, but it has to be within 12 hours to have the best chance of that thing staying in there without having other sorts of internal fixation that really, gets a little expensive. But even with fractures, if those go unstabilized and you have a leg that's kind of flopping around, it can damage the blood supply to the distal limb. And so if you don't have a blood supply below the fracture, obviously it's not going to heal.
Right.
You're going to have some problems that way. And so the sooner that we can intervene in those instances, the better off we're going to be. But the other reason that it's so important too, and I learned this the hard way early on in practice, is that a calf that can't get up doesn't get colostrum. And so if it's a day or two until we get the phone call, well, now not only do you have a broken leg, but you have a calf that doesn't have immunity. And so they're already way behind the 8 ball and they don't have that colostrum, they're going to have infection, and it just increases your morbidity and decreases the risk, or decreases the chances that you're going to have a successful outcome.
So probably want to give that calf colostrum.
Yeah.
And then worry about the leg.
Yeah.
Type of.
Yep. Or in fact, hey, here's an idea. Call me. You give the colostrum while I'm on my way.
That's a great idea.
Yeah.
Yeah, I think that there's a lot of times too when we think there's a calf that we can pull and it's not something we're doing as a producer on a day-to-day basis, but the practitioners are seeing the most difficult cases day in and day out, and just the chance of survivability and the opportunity exists, and that's why those people live in your community.
Right. Absolutely. And so anytime that you can get a veterinarian in on the process, the sooner the better, and the better chance you're going to have a positive outcome.
Well, sure appreciate you being on the show. Appreciate your friendship and all that you do for veterinary medicine.
Thanks. I'm happy to do it.
Great. Folks, Dr. Jenn Schleining, she's the Armbrust Professor of Veterinary Medicine and is a food animal surgeon here at Iowa State University's College of Veterinary Medicine. Thanks for watching Doc Talk. Remember, always work with your local veterinarian. And if you want to know more about what we do on the show, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson. Thanks for joining us on the road today at Iowa State University, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.